Am I a candidate for lower eyelid transconjunctival blepharoplasty with fat repositioning? I'm a 25-year-old boy. I have hollow eyes and it looks so horrible on my face. Can this surgery give a permanent result? Please advise. Thank you.
Thank you for your question. You submitted your question with a photo, and you're asking, are you a good candidate for transconjunctival blepharoplasty with fat repositioning? And in the details of your question, you state you're 25 years old and that you are bothered by the hollows under your eyes and you're looking for some guidance. Well, I can certainly share with you how I discuss options with my patients in my practice every day who come with very similar concerns. A little bit of background, I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, helping people with their under-eye area, whether it's for under-eye bags, bags with hollows, hollows alone, discolorations, wrinkles, and essentially the aesthetics of the eye area has been the foundation of my practice throughout my career and has continued to evolve thanks to a lot more tools that we have in customizing a strategy. So I can certainly understand your concerns about hollow and the attraction of a surgical procedure where you can reduce what is the fat pocket that is present and to try to fill the hollow, which is your primary area of concern. Now, of course, a proper physical examination would involve taking pictures and examining the three-dimensional aspect of the level of the prolapse of the fat and the relative impact on the under-eye tear trough area. I would say that fat repositioning, although it is a reasonable concept when it comes to trying to move fat from one area into a trough area, I would be cautious about using that as your first line of therapy. I can tell you that the goal for most people who have any type of aesthetic issue is to have a procedure that is predictable, that is safe, that is not likely to have any kind of untoward complexities beyond the procedure. I think the tolerance for variability in outcome is becoming essentially almost zero. And so, but beyond that, I would say that the tools that we have in front of us and that we use routinely also change the hierarchy in which recommendations are made. So in a situation like yours, I would probably not do a surgery, again, based on just a photo alone, for a limited amount of fat prolapse where the hollow is the more dominant issue for you. I would, in your situation, consider first for the hollow area, I would use an injectable filler such as Restylane, and I would place that in the tear trough area. That would help with the transition between the fat pocket and the area where it's hollow. And further, discoloration, which is also an important variable in the perception of under-eye dark circles and hollows, I have found a lot of value in using something called platelet-rich plasma. Now, of course, when someone is relatively young, such as a 25-year-old, I would make that decision based on examination looking at skin quality. But at the same time, there has been value in using platelet-rich plasma for discoloration if it's from environmental causes, as well as just as a general skin improvement concept. Basically, your own platelets are concentrated in plasma after the blood is spun. And the growth factors and healing factors help stimulate collagen, stimulate vascularity, and improves the skin quality. Now, when we deal with someone who's relatively young, it seems to still have a value when it's done in conjunction, but it is evaluated on an individual basis. A lot of times I take little steps and I'll start with just a filler and see how much of an improvement we can achieve. It's very important to always manage the cost of doing things with the outcome. And I generally lean towards using PRP for people who have history of sun exposure that is significantly aging the skin, as well as other issues that would require an improvement, or there would be a more significant benefit to skin quality. But when it comes to the anatomy of the under eye area, essentially if the fat prolapse is minimal, then I would suggest considering a filler as the first line of therapy. Now, you may not be excited about doing this on a maintenance type of basis, but generally speaking, a filler under the eye can last up to a year, and it is not unusual for it to last longer. I think that in a way, both the predictability and the convenience and the relative expense makes it an attractive first-line option. I think that without going into unnecessary details, since that would not be my first line, I would be concerned that any type of surgery where you're taking the fat and then trying to move it into that area can be problematic in terms of swelling, lumpiness, irregularities. And so I think that that's a variable that you should be aware of before just doing something that may be attractive, because you may perceive it as having a more long-term benefit in comparison to a filler. So I think it's very important that you meet with qualified, experienced surgeons who perform both injectable filler and surgery, such as lower eyelid blepharoplasty, and learn about what option makes sense for you. As a oculofacial plastic surgeon who has no real limitations and has extensive experience, I would say that it has been tremendous benefit to have the tools and the techniques to do things for patients like yourself with less invasive approaches than surgery, because ultimately our goal is to help our patients look their best in the safest and most predictable way possible. And it's always a balance of relative risk. So I hope that was helpful. I wish you the best of luck. Thank you for your question.